What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for March 21, 2021. Understanding the CDC's new COVID-19 guidance for vaccinated people. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Tara Kirksell of the Johns Hopkins Center for Health Security about the new CDC guidelines on what vaccinated people should and should still not do given the state of the pandemic. When can we throw away our masks? Let's listen.
Tara Kirksell, thanks so much for joining me.
Thanks for having me.
So today I want to talk about the guidelines that the CDC released this week, having to do with what people who've been vaccinated should and shouldn't do now that they are likely immune from the COVID vaccine. This seems to have sort of given them more freedom to socialize and do their daily activities. Could you walk us through the main points?
Yeah, so I think that, it was really exciting when CDC came out with this new guidance, just because, we're expecting it. We know that we're going to be doing different things as people are vaccinated, but I feel like it's spring again. I feel like it's one of the first steps towards getting out of this pandemic and getting back to those things that we've really missed. And so, they talked about what vaccinated people can do. They still need to take some precautions against the potential of spreading COVID-19 because we aren't sure how well the vaccine prevents transmission, but they can start doing lower risk activities. And that's really great.
So I understand that my parents who've been vaccinated can have the couple across the street who's been vaccinated over for dinner, for example. My parents can hug their grandchildren. What kind of things are specific things can we see vaccinated people do now from now on?
Yeah, so we can see that vaccinated people, certainly a lot of the guidance was related to what people can do in their own homes and when getting together with other people. The guidance for what's happening outside in public spaces still remains the same with masking and distancing. But in someone's home, when they're trying to bring friends over or family over, vaccinated grandparents can have their, unvaccinated adult children and their grandchildren over to visit and not worry about it, as long as those people are low risk for having severe outcomes from COVID-19. So, for example, I recently, actually just 2 days ago, my family moved in with my parents because we were having work done in our house, and they're vaccinated. And so this is, an example of what would fall within the guidance for vaccinated individuals.
That's great. That's great. So we don't quite get to throw away our masks.
Right. Well, we still are going to need, and yes, I share everyone's tiredness with masks, but we don't get to throw them away quite yet. When we're in public spaces, when we're in the grocery store, when we're visiting with people who are high risk, these are times when we still need to use our masks and continue social distancing until we have a greater number of people in the general community vaccinated.
Mm-hmm. So I know there's long been conflicting information sort of for what people can and cannot do. Does this clarify that?
I think it clarifies that people will still have very specific questions about their lives, and everyone does. And everyone has sort of the edge case on what should I do in this situation. But I think it does give some clarity. And I think really what this is about, it is about being able to sort of make those initial steps forward in a cautious and vigilant way, but to know that we can start making those steps forward. And I think it's overall, it gives us a sense of how we're going to start moving forward here.
I'm curious whether you think that relaxing the rules for those who've been vaccinated might help with vaccine uptake. I know that there's been some sentiment that, why bother getting the vaccine? I'm just going to have to do the same thing I've been doing, wearing masks, staying home, et cetera. Do you think that knowing that there's an easing for those who have been vaccinated, will that help make the case?
Right. Yeah, I think it really, really will. So people get vaccinated for a couple of reasons, right? Or many reasons. But one of the main ones is so that if they get exposed to COVID-19, they're not going to become severely ill or end up in the hospital or possibly die, right? But there's this other reason that I think is even more important, is that people want to get back to those moments and those, things that they've done that they have really missed. And so I think that saying, okay, we're going to start moving in that direction is really important for getting people vaccinated. I agree that people would have a harder time saying, well, I'm going to get vaccinated, but I still have to do it. I still have to do this, this thing that I'm so tired of, staying in my house and all that stuff. So I do think that this is really important to move forward and give people incentive to go out and get the vaccine.
I know that my parents have been eating, they live in Florida, they've been eating dinner outside with their vaccinated friends. And I think the fact that this sort of gives them the stamp of approval, I think makes me feel better.
Yeah, I definitely think, even for people who've been being cautious, this just, feels good to say, okay, we can start using our brains and act reasonably, but we can start doing those things that we've really wanted to do for a while and have dinner with our vaccinated friends or a limited number of low-risk unvaccinated people.
I guess another question that I have is, do these guidelines go far enough?
So there have been questions about maybe CDC should have loosened up even more. But I think right now, to me, this is a really good middle ground. I was worried that they would be too conservative and, too limiting, which would undermine, some of the desire to get vaccine. But we also don't want to go all the way over on the other side and have people just go back to their normal lives, because we still have a couple questions that we need to have answered about the vaccines and what kind of benefits we're getting from them beyond prevention of severe disease. So I think it's a good middle ground. We should start moving forward cautiously. And, we can always do those things next week, right? Or in a month when we find out that, it makes more sense. And so let's just move cautiously forward. Do one thing that you really wanted to do and then take it slow on the rest.
Mm-hmm. So what can we expect next? What's like the next little step you think that the CDC will allow us to do?
Well, I would expect to see, the next, if this is tier 1, then tier 2 might be that we would relax some travel guidelines, not try to tell people that they shouldn't travel if they've been vaccinated. We might see relaxation on recommendations about attending religious services, although we're still not going to see people. We're not going to want to see people packed in a church and singing. And we also might see some relaxation on indoor dining and other indoor activities. But again, we still don't want to have a lot of crowds together until we have a lot more people vaccinated.
Mm-hmm. And so these are these guidances that we just have, the guidelines, that we've just gotten. These are going to be a changing document. Isn't that right?
Yeah. So the important thing that people should remember is that this is interim guidance, right? This is guidance that we're having for this moment right now. As the situation changes, as we get more people vaccinated, as cases go down, the guidance is going to change. And we should look forward to that. I don't think that anyone should say, well, the guidance is different now than it was yesterday, so CDC just flip-flopped on what they were saying. That's not the case. Right now, we have we have guidance for the situation, and we will have new guidance as the situation changes. And we should look forward to those changes, because I think that they'll be good ones.
Yeah. And that's a really good point about this isn't the CDC flip-flopping. The situation is evolving and it's changing, and we're going to continue to learn more about what we can and cannot do safely.
Exactly. We'll have more studies come out that tell us about transmission. We'll see more people being vaccinated. And so I just think that things will, improve over time, and that's going to be great.
One question I have, I guess, is very personally for me. I am last in line for this vaccine. And so while I'm excited that some of the rules are being relaxed, I've been a stickler for the rules the whole time. I go out once a week to the grocery store, double masked, and I walk in the neighborhood. Those are that's how I interact with the world these days. But I'm getting jealous now. So are we I mean, are we creating a situation where people may say, oh, well, if some people are allowed, I'm allowed, even though I'm not vaccinated?
Yeah, so we want to avoid that kind of situation. I share your pain with being lost in line. And, I'd like to do some things too. So I think that this is why we still think it's important to maintain the social norms of wearing masks and distancing in public, because no one really can tell, your vaccination status. And so I think it's important to maintain that. But I am encouraged by the increases in vaccines that are available and also the rate of vaccination. I, at the beginning of this, was worried that it might be the fall before I might get my vaccine. And now I'm feeling pretty good that it might be in the early summer. So I think it's good news all around.
Terrific. Tara Kirksell, thanks so much for joining me.
Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.